I'm Dr. Robert Odell. I'm here to talk about a nerve test that we do that far exceeds the ability of the standard nerve tests, EMGs and NCVs, to diagnose pain. This tests A delta nerves, which is part of the sensory system, whereas the EMG and the NCV generally are only positive after changes have taken place as a result of motor dysfunction. The nerve test is painless, which is not like the EMG and the NCV, and it is done by having the patient sense when they feel a waveform being turned up that measures the A delta nerve function. A delta nerves is the fast pain function. What you will see, for example, as a result, this is normal. You'll see this patient who has neuropathy, all these are very high. It doesn't mean that they're not working, it means they're not working as well. So you'll notice the shorter nerves are normal, the longer nerves are affected significantly. Higher is more affected, lower is less affected. You'll notice after treatment with our neuropathy protocol, this patient has virtually a normal test. There's a little bit of play because it's a biological system. But this test can painlessly follow a patient's progress with neuropathy or with spine problems. In the spine, if somebody doesn't have a neuropathy but has a single level disc, for example, say the L5 disc, what you will see is at L5, this will be a peak up here and everything else will be normal. And that's a way of telling me exactly where I can put my needle for the epidural. One other thing, if a patient has a normal neural scan, and this is huge, or just a slightly positive neural scan, typically they'll have a pain generator which doesn't come from the discs and the nerves, but it comes from the facets, sacroiliac joint, or from the muscles and tendons. That is the huge benefit of this test. The test is 95% specific and 95% sensitive, which has been shown in studies.